vaccine, and we encourage everyone who's offered this opportunity to accept. Lorsque vous aurez reçu votre vaccin,
When you will have
nous
received your
demandons de
vaccine,
continuer, cependant, à
we will
suivre
ask you
les
to
directives
continue to
locales
follow
de
all
santé
local
publique,
public
de
health
continuer à
guidelines,
porter un masque
to continue
et de
to wear
garder
a
une
mask,
distance
and to
sociale
maintain
appropriée.
appropriate social
I would now like
distancing.
to invite my colleague Anita Anand to say a few words. Anita.
Merci beaucoup, Dominic.
Thank you very
Good
much,
afternoon,
Dominique.
everyone. I'm going to speak to two issues today, vaccines and PPE and other supplies. In terms of vaccines, I have a brief update on the progress that we are making to ensure that vaccines are delivered to Canada at an ever-increasing pace. We now have 3 approved vaccines in Canada: Moderna, Pfizer, and AstraZeneca CoviShield. Our strategy of diversification in our vaccine procurements is continuing to benefit us in terms of volume. Last week, Canada received 643,000 doses of the Moderna and Pfizer vaccines in what was our largest delivery of doses to date. This week, we are on track to see approximately 945,000 doses of vaccines arriving in Canada in total. This number includes the weekly shipment of Pfizer vaccines, which this week is 444,600 doses, as well as the first shipment of 500,000 AstraZeneca CoviShield doses, which are now en route to Canada from the Serum Institute and scheduled to arrive in this country tomorrow. Thus, almost 1 million doses will be delivered into this country this week alone, and next week we are set to receive more than 900,000 doses of vaccines, being Pfizer and Moderna vaccines, coming into this country.
You have heard me say it before, and I will say it again now. Canada is on track to ensure that we have enough vaccines for everyone who wishes to receive one can do so by the end of September. Put another way, enough for everyone by the end of the summer.
You've heard me say it before, and I will say it again now. Canada is seeing millions of vaccines coming into this country, and we remain on track to ensure that we have enough vaccines for everyone who wishes to receive one before the end of September. It has been almost a year since our lives were immeasurably altered, and we have faced many hurdles since that time. I will now provide a brief update on our procurements, including PPE and other supplies. At a time of intense global competition for N95 respirators, we have received more than 112 million of these masks so far, and we have in place 2 long-term contracts with domestic manufacturers. For example, Medicom has produced 6 million plus N95 masks to date. We have received more than 20 million liters of hand sanitizer, more than half of which was made in this country. 40.5 million rapid tests have been procured, with more than 22 million of these tests delivered directly to the provinces and territories. Nearly 190 cold and ultra-cold freezers have been delivered as well. 7 million low dead volume syringes have already been received, and millions more are en route. These are the procurements that we have made, in addition to many others, for the interests of Canadians' health and safety. And we will continue to make these procurements while we battle this pandemic. To conclude, Canada is prepared and Canada remains on track.
During this time of unprecedented global competition for vaccines, we are continuously working to accelerate deliveries. We saw early deliveries in December, additional doses in this quarter, millions of additional doses added to second and third quarter deliveries.
During this time of unprecedented global competition for vaccines, we will continue to work to accelerate deliveries. We saw early deliveries in December, additional doses in this quarter, and millions of additional doses added to the second and third quarters. While there remains a good deal of work to do, we have a long-term plan in place. We remain focused on it, and we will continue to pursue it in the interests of all Canadians. Thank you. Merci. Miigwech.
Anita, thank you very much. I'll now turn to Doctors Tam and then Dr. New.
Thank you. And bonjour à toutes et tous.
Good afternoon, everyone.
There have been 870,033 cases of COVID-19 in Canada, including 22,017 deaths. Following a month-long decline in COVID-19 activity, daily cases counts have leveled off, and we're now seeing a moderate increase nationally. There are now 30,430 active cases across the country. Over the past week, an average of 2,933 new cases and 42 deaths were reported daily. During the same time period, 2,169 people with COVID-19 were being treated in our hospitals each day, including 568 in critical care. When case counts remain elevated or increase further, the concern is that we will soon see an impact on hospitalization, critical care, and mortality trends. At the same time, the number of cases involving more contagious variants of concern continues to increase. As of March 1st, a total of 1,257 B117 variants, 99 B1351 variants, and 3 P1 variants have been reported across Canada. Although the highest numbers have been reported in the more heavily impacted provinces, no province has been spared. Smaller provinces in the Atlantic region shows us that after many months of strong control, the situation can quickly get out of hand once more contagious variants are introduced. By the same measure, these provinces demonstrated that quick, strong public health action is the best way to regain control. On the really hopeful side of the vaccine versus variants leg of this marathon, we are gaining more ground every day. Last week, Health Canada authorized 2 additional safe and effective COVID-19 vaccines. We now have 4 different COVID-19 vaccines with unique advantages, but all contributing to the reduction of severe COVID-19 illness and death in Canada. To that end, yesterday, the National Advisory Committee on Immunization, or NACI, updated its guidance to include recommendations on the use of the newly authorized AstraZeneca COVID-19 vaccine formulations for optimal public health benefit. NACI is also assessing the time interval between the first and second doses of currently authorized COVID-19 vaccines to allow as many people as possible to be vaccinated while not compromising vaccine effectiveness. NACI is currently considering evidence from the latest scientific studies and is aiming to provide their recommendations this week. As the science of COVID-19 vaccination continues to evolve, expert advice is being adapted to maximize the benefits of all of the authorized vaccines. Canadians continue to support these efforts, not only by sacrifices we've made to buy time for research and innovation, but also through incredible levels of engagement, learning, and trust in the scientific process. This has been a difficult and long journey, but I know we remain steadfast in our resolve to see things through, aiming for the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible is how we can all contribute our personal best to limit the spread of COVID-19 while vaccine programs continue to expand to protect all Canadians. Thank you.
Bonjour à toutes et à tous.
Good afternoon, everyone. To date, there have been 870,033 cases of COVID-19 in Canada, including 22,000 deaths. Following a month-long decline in COVID-19 activity, daily case counts have leveled off, and we are now seeing a moderate increase nationally. There are now 30,430 active cases across the country. Over the past week, an average of 2,933 new cases and 42 deaths were reported daily. During the same period, 2,169 people with COVID-19 were being treated in our hospitals each day, including 568 in critical care. When case counts remain elevated or increase further, the concern is that we will soon see an impact on hospitalization, critical care, and mortality trends. At the same time, the number of cases involving more contagious variants of concern continues to increase. As of March 1st, a total of 1,257 B117 variants, 99 B1351 variants, and 3 P1 variants have been reported across Canada. Although the highest numbers have been reported in the more heavily impacted provinces, no province has been spared. Smaller provinces in the Atlantic region show us that after many months of strong control, the situation can quickly get out of hand once more contagious variants are introduced. By the same measure, these provinces demonstrate that quick, strong public health action is the best way to regain control. On the hopeful side of the vaccines versus variants leg of this marathon, we are gaining more ground every day. Last week, Health Canada authorized 2 additional safe and effective COVID-19 vaccines. We now have 4 different COVID-19 vaccines with unique advantages, but all contributing to the reduction of illness and death in Canada. To that end, yesterday, the National Advisory Committee on Immunization, NACI, updated its guidance to include recommendations on the use of the newly authorized AstraZeneca COVID-19 vaccine formulations for optimal public health benefit. NACI is also assessing the time interval between the first and second doses of currently authorized COVID-19 vaccines to allow as many people as possible to be vaccinated while not compromising vaccine effectiveness. NACI is currently considering evidence from the latest scientific studies and is aiming to provide their recommendations this week. As the science of COVID-19 vaccination continues to evolve, expert advice is being adapted to maximize the benefits of authorized vaccines. Canadians continue to support these efforts, not only by the sacrifices we've made to buy time for research and innovation, but also through incredible levels of engagement, learning, and trust in the scientific process. This has been a difficult and long journey, but I know we remain steadfast in our resolve to see things through. Aiming for the fewest interactions with the fewest number of people for the shortest time, at the greatest distance possible, is how we can all contribute our personal best to limit the spread of COVID-19 while vaccine programs continue to expand to protect all Canadians. Thank you. Thank you very much, Dr. New. And now we will move on to Major General Fortin. Thank you, Minister, and good afternoon, everyone.
Good day, everyone. To date, we have distributed 2.9 million doses of vaccines across the country. This week, as previously mentioned, 444,000 doses of Pfizer-BioNTech are being distributed. So we anticipate receiving over 2 million doses spread over the 5 weeks of March with equal amounts each week. By the end of the first quarter, we will have delivered 4 million doses of Pfizer-BioNTech. Pfizer-BioNTech has also confirmed shipments going into April. Shipments in the first 2 weeks of April is expected to be around 769,000 per week, and we're in the process of aligning those orders with provinces. As for Moderna, the manufacturer has confirmed and will now start shipping on a 2-week schedule. We expect to receive 466,000 doses for Moderna next week, and the second shipment will be 846,000 doses arriving during the week of March 22nd. So this will bring the total doses of Moderna to 2 million from December to March. April allocations detail are not yet available for Moderna, but we're working closely with Moderna to ensure a consistent and adequate supply. Last week, Government of Canada announced that the Oxford AstraZeneca vaccine has been authorized by Health Canada, as well as Serum Institute vaccine. 500,000 doses or early doses of the vaccine manufactured at the Serum Institute of India are expected to arrive in Canada as early as tomorrow. As for the balance of 1.5 million, 1 million are expected in April and 500,000 are expected in May. Following this good news, we launched discussions with provinces and territories on a per capita allocation of the allocation doses, allocation of the available doses by the end of March. Based on their returns, the National Operations Center here will then move forward with the order process, and first deliveries are expected to take place in the coming days. So 300,000 doses will be expedited as quickly as possible, as these will need to be administered by April 2nd. Starting next month, we anticipate a steep increase in vaccine availability, and our efforts shift the vaccination ramp up. We're expecting to receive around 23 million doses of Pfizer-BioNTech and Moderna between April and June. AstraZeneca vaccines will be available with at least 1.5 million doses manufactured by Serum Institute arriving in mid-May, with more added to this package as we move forward. We continue to support the provinces and territories by providing them with as much predictability as possible on future shipments, and by bolstering their existing infrastructure and enabling equipment in order to optimize their immunization plans. We'll continue to lead the planning effort to ensure that the processes for delivering, storage, handling, and immunization clinics in the provinces and territories can keep pace with increasing shipment sizes of the authorized COVID-19 vaccines. So we'll remain committed to communicating updates or changes in the vaccine delivery plan so that provinces and territories are able to plan immunizations in line with vaccine availability. This is especially important as each provincial and territorial government is responsible for deciding how to distribute and allocate vaccines in their jurisdictions. Alors, à ce jour, nous avons distribué 2,9 millions.
To date, we have distributed approximately 2.9 million doses to provinces and territories. This week, as I mentioned earlier, 444,000 doses of the Pfizer-BioNTech vaccine are being distributed. We anticipate receiving over 2 million doses spread across 5 weekly shipments of 444,000 each in March. And by the end of the first quarter, we will have delivered 4 million doses of Pfizer-BioNTech. Pfizer-BioNTech has also confirmed shipments going into April. So for the first 2 weeks of April, April. Shipments are expected to be around 769,000 doses per week. We will be confirming the exact numbers over the next few days. As for Moderna, the manufacturer will now start shipping on a 2-week schedule. We expect to receive 466,000 doses from Moderna next week. And the second shipment will be of 846,000 doses arriving during the week of March 22nd, which means a total of 2 million doses from December to March. April allocation details are not yet available. However, we are working closely with Moderna to ensure a consistent and adequate supply in order to be able to go ahead with planning in provinces and territories. Last week, the Government of Canada announced that the Oxford AstraZeneca vaccine has been authorized by Health Canada. 500 early doses of the vaccine, manufactured at the Serum Institute of India, will be available in the coming days, starting tomorrow. As for the balance of 1.5 million doses, 1 million are expected in April and 500,000 are expected in May. Following this good news, over the past weekend, we launched discussions with provinces and territories on the per capita allocation of the available doses by the end of March. Based on the returns provided from the provinces and territories, the National Operations Centre will then move forward with the ordering process, and the first deliveries are expected to take place in the coming days. 300,000 doses will be sent to the provinces and territories as quickly as possible because they have to be given by the 2nd of April. Starting next month, we anticipate a steep increase in vaccine availability from authorized COVID-19 vaccine manufacturers. We are expecting to receive around 23 million doses of Pfizer, BioNTech, and Moderna between April and June, and 1.5 million doses manufactured by the Serum Institute will be arriving by mid-May, and there will be more forthcoming. We continue to support provinces and territories by providing them with as much predictability as possible on future shipments and by bolstering their existing infrastructure and their enabling equipment in order to optimize their immunization plans. We will continue to lead the planning effort to ensure the processes for delivering, storage, handling, and immunization clinics in the provinces and territories can keep pace with the increasing shipment sizes of the authorized COVID-19 vaccine. So in conclusion, we remain committed to communicating updates or changes in the vaccine delivery plan so that the provinces and territories are able to plan immunizations in line with vaccine availability. This is especially important as each provincial and territorial government is responsible for deciding how to distribute and allocate COVID-19 vaccines within their jurisdictions. Thank you. Thank you very much, General. So, Corinne, we are now ready to receive questions.
Thank you.
Thank you. We're now going to move on to questions. And a reminder, the rules are 1 question and 1 follow-up question each.
We will now take questions. As a reminder, you get 1 question and 1 follow-up question each. All questions today are on the phone. Donc, opérateur, première question.
Operator, first question.
Thank you. Merci. If you have a question, please press star 1 on your device's keypad. Si vous désirez poser une question, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question is from, la première question est de Abigail Beeman de Global News. Please go ahead, à vous la parole.
Thanks for taking my question. I'm wondering first, what's your response to BC's decision to extend the second dose to 16 weeks? I noted that Dr. New, back in January, you said the core recommendation is that the system follows the manufacturer's layout. So I'm wondering if you still believe that's the case, or do you think other provinces should do what BC has done?
Well, thank you for the question. I'll maybe answer first because you made reference to my comments earlier, and it's certainly I know Dr. Tam has comments as well. Certainly my comments back in January were based on the information we had at the time, which was basically the clinical trial data, which was submitted by the companies, in this case, I guess, Pfizer, BioNTech, and Moderna, that led to the approval by Health Canada for the use in Canada. And since that was the only quote data we had at that time, certainly the recommendation was that that the vaccines should be used in accordance with the manufacturer's sort of approval with respect to the dosing interval. Now, what's happening is I think very encouraging, as I mentioned a few weeks ago, is that we have real world data, the actual experience of what's happening with the vaccinations. For example, in British Columbia and in Quebec, as they're vaccinating seniors in long-term care facilities and so on, and we're seeing quite a high level of protection. And also, it seems that the protection is obviously lasting for obviously even after the first dose. So, with that new information, obviously our experts, including our National Advisory Committee of Immunization, is looking very carefully at that and looking at exactly the point that was made earlier about what is the balance between vaccinating a larger number of Canadians and giving them a good level of protection with sort of looking at the interval while not compromising the effectiveness of the vaccine. And so I think that that's a live issue. The committee actually did give us a presentation to all the chief medical officers of health, including Dr. Tam and myself. And I think, as we just said in our statement, NACI will be coming forward with a statement, I think, shortly based on their deliberations. And I think I can't really speak to British Columbia, but certainly what they're doing, I think, has been taken into account all of the good information that's been discussed and presented to all of us. I'm not sure, Dr. Tam, would you add anything else?
Just to reinforce that, I just want to thank the National Advisory Committee on Immunization. They did give all the chief medical officers of health a good briefing on their findings and looking towards the publication this week, which should be very soon. And I think, as Dr. New has said, Health Canada authorizes vaccines based on the fact that they are effective, efficacious, basically, in clinical trials, and with additional data, they're safe and they're of high quality. What the National Advisory Committee on Immunization is doing in support of the provincial and territorial decisions on their vaccine rollout is to take into account not just the real data on some incredible data, actually, on just how effective these vaccines are in real life, even after one dose, that have endured a significant number of weeks. So over 2 months of data and beyond, showing that sustained level of effectiveness, but also taking into account the very fortunate situation we have in Canada, where now we have several different vaccines, and we can make decisions on how best to utilize all of them in concert. So that is a little bit different to how the regulator essentially approves each of the individual vaccines. When you have more than one of them, you're going to then give your best advice as to how you best utilize them based on the information. And lastly is that there will be a continuous monitoring of the vaccine effectiveness as we go along, not just globally, but British Columbia and Quebec, for instance, who have already stretched the interval of administration between these two doses, giving us the domestic real-life data from long-term care, from healthcare workers.
Thank you. I'm also looking for you to weigh in about the NACI recommendations not to use AstraZeneca in people 65 and older, specifically as France had reversed its similar decision, saying that there's more data out there showing the benefits for older people, and UK and Scotland have released similar real-world data showing its effectiveness in older people. So why would Canada recommend this approach?
Well, I think, again, the National Advisory Committee on Immunization looked at the data they have at hand, including some of that you've mentioned, and that is their recommendation at this time. Also recognizing of the fact that we actually have more than one vaccine, as I've just said, and I've already started immunizing, providing vaccines to some of the NACI recommended higher risk groups. So that is also taken into account as well. But fundamentally, is that they will update, and I think just watch this space, as they see more and more of that real world data accumulating, that will be adjusted as well. So this is both a challenge, but also really exciting because I think the real world data helping us to adjust our vaccine program is a really positive move. But I think don't read their recommendations as sort of static. They will update as needed, but this is what they've recommended at this point in time.
Merci, thank you. Prochaine question,
Thank you.
next question.
Our next question.
Thank you. Merci. The next question is from, la prochaine question est de Philippe Vincent Foissy de Radio-Canada. Please go ahead. À vous la parole.
Question from Radio-Canada. Good afternoon. I have two brief questions on the AstraZeneca vaccine. From what I understood, there were 300,000 doses that were soon going to expire, and so they had been discounted. So I'd like to know how you're advising provinces to use them when there have been there's been contrary advice given in terms of using them for the 65 and older age group. Answer. I don't know who wants to answer this question in terms of the quantity and the discount, but I can speak to the use of the AstraZeneca vaccines from the Serum Institute. We've all seen the recommendations from the National Advisory Committee, and as Dr. Tam noted earlier, the age group recommendations is based on the evidence analyzed to date by the committee. Now, obviously, provinces and territories will have to consider their own context, their own at-risk population, and they can always decide on the best way to use their vaccines for their populations. So that would perhaps be a question to be put to the provinces and the territories. Anita, do you have anything to add to this? Yes. Of course, I would like to add a few words. It's important to remember that the 500,000 first doses will be arriving over the coming days. And the second shipment will include over 1 million doses, and that will be arriving in the second half of the month of April. And the third shipment of 500,000 doses will be arriving by mid-May. Now, the provinces and territories, and this is very important for me to point out, have assured the federal government that they are ready to administer incoming doses in order to ramp up the vaccination process. And we have committed to ramping up those deliveries so that this will all happen. And I think that's the most important thing to point out. Everyone in Canada, the provinces, the territories, everyone has assured the federal government that they are ready to administer these vaccines. And therefore, we have ordered those vaccines for the country, for all the provinces and territories. Thank you very much. Follow-up question. And so,
Oui, donc la question de suivi.
And follow-up question. Can I put my question now?
Oui, vas-y.
Yes, go ahead. Yes, I will add something after your follow-up question, says the minister. Go ahead, please, right away. Answer, thank you very much. It's not true to say that there was any sort of discount. That is not the case. We ordered and purchased vaccines from the Serum Institute along with the other vaccines. And that was the expected transaction with Serum Institute for the millions of doses. Thank you very much, and thank you for answering in French, Minister. So, follow-up question. Currently, Canadians are quite confused. They've been hearing what Health Canada has said about 65 years and older. They have heard about other information coming in about these vaccines. Provinces will be determining this on a case-by-case basis, but there is fear because of the confusion, especially amongst the 65 and older. It's seniors who are being vaccinated right now. So what can you tell Canadians to reassure them so that they feel safe with these vaccines, especially those who are 65 and older? So there's a considerable amount of confusion, and it might be a good time to actually clear up that confusion. Answer? I'll start with an answer and then ask Dr. New to continue with the scientific answer. As a national government, we said that we would be purchasing different kinds of vaccines. We've been saying that over the preceding months. Now, 3 to date have been approved by Health Canada, and they've been vetted as being safe and effective. And we expect all scientific discussions to take place, all appropriate discussions. If Health Canada approves more vaccines, it provides more tools to the provinces and territories, and they do this based on their scientific advice. It provides everyone with more choices and opportunities to immunize their citizens. And we will continue as a national government to purchase the greatest number of vaccines that we can, and obviously await approval from Health Canada. And we will be sending those to the provinces and territories. We have known for several months what we need to do, and if there are other approvals forthcoming, for example, from Johnson & Johnson over the next few weeks, then, of course, there will be even more tools available to provinces and territories. They will be able to use these tools to immunize their populations as quickly as possible. So all this has been thought about over the months. And in terms of the specific scientific question you had, in terms of those who are 65 and older, perhaps Dr. New can add to this answer. Thank you, Minister LeBlanc. What I can tell you is this. All vaccines that have been approved in Canada are safe and effective. And all the vaccines have shown to date that they are effective in reducing the serious illness and deaths connected to this disease. There's no confusion about that. Now, in terms of the National Advisory Committee, they will look at available and have been looking at available real-world data to date. And they base their decisions on that. So there isn't necessarily enough data to date to be able to provide recommendations in terms of the 65-year group and older. It doesn't mean that the vaccine is not effective for all ages. It simply means that there has to be sufficient data. As Minister LeBlanc said, we have a range of tools at our disposal in terms of the vaccines in Canada. And obviously, provinces and territories are going to avail themselves of that entire range of tools and vaccines to immunize Canadians. This has already begun with 2 vaccines, and with the AstraZeneca approval for the vaccines from India, then we'll be able to add this to the toolkit. But I don't see any problem or any confusion surrounding this. All vaccines are safe and effective.
Merci. Thank you. Next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, the National Post. Please go ahead. À vous la parole.
Yeah, I wanted to ask about the 20 million doses of AstraZeneca that will be coming from the U.S. Beyond the Serum Institute's doses. We've heard a lot of talk from the Biden administration that they won't be allowing vaccines to leave the U.S., that they won't be ready to share until the American population is vaccinated. I'm wondering what assurances you have that those vaccines are going to be delivered to Canada, and if you have any sort of indication of the schedule for those deliveries.
Thank you, Ryan, for the question. We are receiving 20 million doses from a facility in the United States under our bilateral agreement with AstraZeneca. Those deliveries are going to be coming in Q2 and Q3. I have spoken with the corporation, AstraZeneca Canada, late last week to continue discussions relating to the delivery schedule for Q2 and Q3. And as soon as that delivery schedule is firm, we will provide it to the Canadian public and you, of course. We want to make sure that we have confirmations from the company before we provide that information, of course. And then on the question of assurances from the United States, we are in close touch, as I mentioned, with the corporation that has indicated it has not seen any problems with the export of doses to Canada. In addition, we have spoken with our embassy to ensure that those doses will be leaving the United States, and we have no reason to doubt that they will be coming into this country. But by the same token, we are ensuring that they will be delivered here across the border, just like we did with the N95 masks back in the spring. You will recall that initially we were told they would not be leaving the United States, but our diplomatic efforts and our work with the corporation allowed those masks to come into the country, and we will utilize whatever means necessary to ensure those vaccines come into this country. It is a priority for us, of course, given the approval of that vaccine last Friday. Thank you.
Ryan, your follow-up?
Yeah, just as a follow-up, I know you mentioned the assurances you got from the company and the successful relationship with interaction, I guess, with the 3M mask in the spring. But I'm wondering if you have any specific assurances from the Biden administration that they won't block these doses. And if they do, I know AstraZeneca is manufactured all over the world in a variety of different plants. Is there a possibility of shifting Canada's delivery to one of those plants that included in the contract?
Okay, thank you, Ryan. Let me break down the AstraZeneca doses and where they are potentially coming from. At the current time, as I mentioned, the 20 million AstraZeneca doses under bilateral arrangements would be coming from the United States. That's the first tranche, if you will, the first agreement. Secondly, the serum doses are coming from India. First batch arriving tomorrow, 500,000 doses in this country, which is very good news for Canadians. And the third tranche or area where we would see AstraZeneca doses coming from is via the COVAX facility out of South Korea at the current time. The discussions with AstraZeneca have been very positive, and AstraZeneca, in fact, has been very helpful in terms of suggesting alternatives if we run into any roadblocks. And those are solid relationships that we will continue to rely on. We have to understand that those relationships are extremely important given the intense pressure for vaccines in the global vaccine supply chains. And our goal at the outset, and it continues to be our goal, is to secure multiple sources and locations of production for this vaccine around the world. And it is on that rationale that we have this three-pronged approach to AstraZeneca doses coming into this country. Again, with our diversified approach, we have secured the earliest possible delivery of approved vaccines to Canada, with deliveries of the first 500,000 doses beginning tomorrow. Thank you.
Merci. Thank you. Prochaine question.
Thank you. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Marie-Kay Walsh de Globe and Mail. Please go ahead. À vous la parole.
Hi, thanks for taking my questions. As a follow, I think, to Ryan's questions, are you able to explain why it is that Canada only negotiated the deliveries of AstraZeneca vaccines in its contract after March? Why didn't it secure earlier?
Well, thank you, Marieka, for the question. I want to be clear that Canada was the first country to be able to reach a deal with AstraZeneca where there was no domestic manufacturing. And so AstraZeneca actually prioritized Canada, allowing it to enter into a bilateral transaction, despite the fact that there wasn't domestic manufacturing here. Once we secured that agreement with AstraZeneca for the delivery of 20 million doses here, they were very helpful in terms of isolating where they would be able to get that supply from. And the conversations prior to signing the deal saw us examining multiple places in the world of potential supply, and ultimately AstraZeneca was able to assure us of supply from the United States. But I want to reiterate the point that Canada was very well placed and treated by AstraZeneca in terms of signing a bilateral agreement with us without domestic biomanufacturing, where it did not do that with any other country prior to that conclusion of the deal.
Okay. I'm not sure that really explains why we were only able to negotiate delivery in April, but I just wanted to go back to what you were saying in French about the Serum Institute. Can you explain in English why we're getting shots that are expiring so soon and what impact that had on price? Do we still pay full price, or are we getting this at a discount?
Well, let me just say that the serum deal is for 2 million doses overall. 300,000 of those doses have the doses that need to be administered within 30 days. I want to be clear that all doses have expiry dates. The remainder of that tranche has to be administered within 60 days. And so it is important to recognize that we have high demand for vaccine in this country. We have provinces and territories that have repeatedly told the federal government that they want vaccines as soon as possible, and they're ready to administer vaccines as soon as possible. And on the basis of their desire for more vaccines, we executed a transaction for the delivery of 2 million vaccines within the next few months, the first 500,000 of which are arriving tomorrow. So in other words, we are responding to the desire for an increased number of vaccines. We are accelerating deliveries of vaccines from one quarter to the next. So you've already seen we are now at 6.5 million vaccines for Q1 alone. So beating our target of 6 million vaccines under Pfizer and Moderna now that we have another approved supplier. And in addition, we will continue to accelerate doses of vaccines. For example, since our initial agreements, we have accelerated the delivery of approximately 14 million doses of the 3 approved vaccines into the second quarter alone, the bulk of which are Pfizer and Moderna, 13 million doses of Pfizer and Moderna in the second quarter as opposed to the third quarter. So all of these transactions and negotiations are occurring against the backdrop of A, heightened demand for vaccine in Canada, B, the request of provinces and territories to have vaccines as soon as possible. That's our goal, and that's what we're responding to.
Merci. Thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur, c'est à vous.
Thank you. Merci. The last question is from, la dernière question est de Catherine Lévesque de la Presse canadienne. Please go ahead. À vous la parole.
Question from Presse Canadienne. Good afternoon. I'd like to follow up on this and ask a question to Major General Fortin. Could he please clearly explain why the AstraZeneca doses will have to be used by April, and can you please explain when they're expiring? And will that be the case for all AstraZeneca shipments from the Serum Institute? And will that be the same for these ones coming from South Korea as well? Answer. Well, I think Minister Anand has explained this very clearly. All vaccines have an expiry date. In the current case, 500,000 doses from the Serum Institute are arriving this week. 300,000 have an expiry date on April 2nd, rather. And obviously, the province and territories will have to quickly administer their vaccines when they arrive. Now, we don't want vaccines to be sitting for too long in freezers and fridges everywhere. We want these vaccines to be administered as quickly as possible and as effectively as possible. This is an effective vaccine. Obviously, it has to be used within a certain time frame, and that's a good thing because we want Canadians to be vaccinated. In terms of the other AstraZeneca vaccines, and specifically from those from the Serum Institute, they all have expiry dates. They come later, and we do not anticipate any problems in their administration. Perhaps I could also add a point to this. Now is not the time to be stocking up on vaccines. They should be used as quickly as possible. The provinces and the territories asked us to deliver these vaccines as quickly as possible. That was our goal. That's what we plan on doing. And it's something that we are going to do over the coming months and year. Thank you. Follow-up question?
I'm just going to turn to Dr. Tam for a question that was mentioned earlier, but I think you can maybe provide an answer on this. Since time is of the essence with the AstraZeneca vaccine, as your colleagues just said, are you suggesting, or do you think that it could be a good solution, in fact, that these AstraZeneca doses, given that there are contradicting facts or findings on who should be getting them, are you suggesting they should be administered to essential workers or racialized Canadians that are mostly affected by COVID-19? Could that be a good solution to get them quickly in people's arms?
I actually just want to reemphasize what Minister Anand said. It doesn't matter which vaccine you're going to have. One should be giving them out as fast as we get them. So that is a general principle. And that, right now, I think all the vaccines are being given out really fast. So this is absolutely a area that all the provinces are discussing. We are discussing this at the Special Advisory Committee. In the end, it's up to the provinces to roll it out. But with the National Advisory Committee on Immunization's recommendations, you've essentially seen that one of the key ways to roll this vaccine out fast is in that younger population as a key option. And some of these groups are potentially prioritized a little bit later on in terms of the staging. Now there's an opportunity potentially for this a group of people who wouldn't have got the vaccine till a couple of months later to have the opportunity to get it. So and if you looked at the NACI prioritizations, some of these groups do include the ones that you've listed, but it is up to the province and territories to implement how they're going to use the AstraZeneca vaccine.
Merci, thank you. This puts an end to today's press conference. Ceci met fin à la conférence de presse
This wraps up
d'aujourd'hui.
today's press conference. Thank you.